Against the backdrop of seasons in transition, Hospice of Dutchess and Ulster County held their annual fundraising gala, aptly titled A Sporting Life. In addition to the silent auction to raise funds, demonstrations from West Mountain Kennels upland bird dogs and sky hunters in flight drew a contrast between the vibrance of life and the changing seasons. The mission of Hospice is to make sure those with life-limiting illnesses have access to quality palliative and hospice care at the end-of-life stages.
We knew that the challenge out in the community was people thought it was for cancer patients only, old people, and poor people. And that's been a challenge right from the very beginning.
We look at life a little differently, that you make the best of the moment. It's not about the quantity of time you have, it's the quality of life.
Hospice provides palliative care. It's pain and symptom management as well as psychosocial support for the patient and family when they have a terminal prognosis of 6 months or less.
It really brings an interdisciplinary team to the family and the patient. So you have a physician, you have a nurse, a social worker, counselors, volunteers if you want them. Most hospice is provided in the person's home, though it can be in a nursing home or a general inpatient stay as well. Because it really is about how you live and quality of life and doing what you want to do despite having a terminal illness.
People in the community, the neighbors, friends, extended family begin to challenge, why are you going on hospice? That's giving up. And it really isn't. What it is basically saying that I've had this disease for a number of years, I've gone through all of the options, I come to a conclusion that I know that I can't do anything about the disease that I have, and I want to live the rest of my time at the highest quality I can. And that highest quality very often means lessening the amount of pain, discomfort that I have.
We bring in medical equipment specific for their needs, whether it's a hospital bed or a walker or oxygen. We look at every case individually. That's why it's such a unique care experience.
For not only the patient, but for the total family that's involved with the situation.
Hospice really is about family. The family is a unit of care in hospice. This event is definitely planned for families and bringing people together, so it's really a perfect marriage.
And the changing of the seasons as a backdrop for the event is a fitting reminder of the fragility and impermanence of life. The fundraising event drew many from the greater Hudson Valley to not only support the hospice organization, but to honor those who have given so much of themselves to help others.
For their dedication to hospice and to the Mid-Hudson Valley community on this wonderful fall day, October 16th, 2010. Congratulations to both of you.
It's wonderful to see all the community support for what hospice does. They do a wonderful job. They bring high quality care to the residents of Ulster and Dutchess County.
Hospice is a very, very classy organization, and being honored by them is a big honor.